Assalamu alaikum, dear students. We are discussing the assessment methods in undergraduate medical education. This is our third session on this topic, assessment methods in undergraduate medical education. We discussed that there are two types of assessment. Here we can say that assessment can be done in two different fields. That is, one is when we are checking the cognitive domain, we are checking the knowledge of our students, we are checking the level of cognition in our students. And the other is when we are checking the actual skills, the different competencies when we are checking for our students of health sciences. But before going to that, let me just some go into the background of the assessment, that why assessment is important, what is the rule of assessment. असेसमेंट जो है ये किसी भी मेडिकल प्रोफेशन में, किसी भी मेडिकल कुरिकुलम में इसका जो रूल है ये बहुत सेंट्रल रूल है. And it complete the learning process by measuring the student progress and achievement regarding the curriculum outcomes. It give a feedback to the teacher that उन्होंने जो outcomes जो है, उन्होंने जो objectives के मुताबिक उनको curriculum के objectives के मुताबिक जो instructor ऑब्जेक्टिव्स होते हैं, लर्निंग ऑब्जेक्टिव्स, उनके मुताबिक जो स्टूडेंट्स को पढ़ाया होता है, क्या वो आउटकम जो है अचीव हो गई हैं कि नहीं. सो दिस इज दैट फीडबैक फॉर द टीचर्स एज वेल एज if we look into that summative assessment, it make students eligible to promote into the next step, into the next semester, into the next year. So we can say that the rule of assessment that have a very central and very vital role in the learning process in the medical curriculum. Several tools have been developed for serving this purpose. Some of these methods focus on, as we discussed, on the cognitive domain of learning, and that's some tools that require the student to present uh, and to uh, assess and to talk about their practical skills. So we can say that the assessment can be of two types: one in which we assess the knowledge of our students, and the one in which we assess the practical skills of the undergraduate students or of the different medical students. So previously we discussed in detail about these different tools which can be used for the cognitive domain, and some of the tools have been also discussed for the assessing the practical skills. Today we will talk about the second last one in the assessing the practical skills of our student, and that is the mini clinical evaluation exercise, which can simply be called as the Mini-CEX or the Mini-CEX. इससे पहले जो है हमने बात की थी 360 वैल्यूएशन की, and before that we discussed the difference between the formative and summative assessment. We discussed different other assessment tools as well, which can be used to assess the practical skills for the undergraduate student of health sciences. Mini-CEX or the mini clinical evaluation exercise. This is one of the most frequently used assessment tool that measures the training performance in workplace. But as we are talking about the undergraduate students, so this mini clinical examination is used is very limited at the undergraduate level. In its original form, though there is a modified form as well. So in the original form, when it was initially educated to the students, that original form, that we can say that the initial released Mini-CEX, that is a 9-point rating scale, which is organized into 3 levels of different the results, that is unsatisfactory, which is from 1 to 3, and satisfactory when it is 4 to 6, and when the points they are from 7 to 9, that is very high satisfactory. In the Mini-CEX, usually an expert, or we can say that a faculty member, they observe the actual performance of the students the practical skills of the students. And if it is in the workplace, we can say that then the trainees and then these faculty member, they rate their history taking and physical examination skills, and after rating, they just also provide the feedback to the students. Usually, the faculty member, that's not a single person. Different experts that rate several clinical encounters of the students throughout the course, throughout that procedures. So, and these mini CX, these are based on tutor observations of the routine interactions, and that's supervising the clinician and trainees and on daily basis. These training patient encounters occur on multiple occasions with different evaluators and in different settings. They are really, really short observation, which may be from 10 to 15, or we can say that 15 to 20 minutes. And that is recorded on a 4-point scale, and in which one is the unacceptable, 2 is below the expectation, 3 is met expectation, and 4 is exceeded expectation. And then these points, they are combined to have a total score, which we have discussed previously, that may be satisfactory, there may be the high satisfactory, there may be the unsatisfactory. The Mini-CEX incorporate an opportunity for the feedback from the evaluator, and mostly used for the formative assessment. Evaluators consist mostly of tutors whose primary is to teach the clerkship students. Several competencies are evaluated by the Mini-CEX, that may be the history taking, the physical examination, clinical judgment, counseling, professionalism, as well as the differential diagnosis, both the subject to and object to examination, and as well as the different management procedures, the different methods of how they are dealing the patient. And in this Mini-CX, it is not only they are checking the practical, but also they are assessing the affected domain, the in which that is how he valued the patient, different aspects. So this is an example of the mini clinical evaluation exercise form, in which there are uh, different aspects of the evaluation. That is, it may be the physical examination skill, that may be the subjective examination, that may be the objective examination. And then there are 9 points, and the examiner, they will just rate the objective examination or the subjective examination among 1 to 3, that is unsatisfactory. If it is between 4, 5, 6, that will be satisfactory, and it is 7, 8, 9, this is the superior, we can say that the high satisfactory. Before that, the different demographic information that is being written there, uh, that has written there, then who is the evaluator, and then the patient problem diagnosis, what is that? The case is the clinical scenario is where the setting is inpatient, and this is the outpatient. What is the age of the patient, gender of the patient? It is a new patient, and it is in the coming up for the second, third, fourth, and so on follow-up sessions. What is the complexity of that? It is low, moderate, and high. And what is the main focus of this mini clinical evaluation? It is even, it may be different aspects. So what is the focus on specifically this form? This is in the data given from the history taking, from the objective and subjective examination. Either it is from the diagnosis and the differential diagnosis. It is made, it is the focus is on the management and the therapy, the treatment of the intervention of the that patient, and then when it is the come towards the educating the patient about the counseling the patient, discussing the issue with the patient, how he is discussing the how he is counseling him. The therapist, or the we can say that here the clinician or that clinical supervisor or the faculty member, they will just check that what is the focus. And I'm assessing which aspects of the management, either it is the start, which is the examination, diagnosis, or the treatment. So there will be then other qualities of the, we can say other aspects, other competencies as well, like humanistic qualities, professionalism, which may be the effective domain, the clinical judgment, the counseling skill, the organization efficiency, and overall clinical competence. One thing which is important in that, if there is no observation of any aspects, so simply instead of giving no feedback and unsatisfactory, satisfactory, superior to that, suppose organizational and efficiency. So if he have no observation, so he should check that not observe. It mean if we have observed, he should have the faculty member, the clinical supervisor should have marking on any of these points. But if was not observed, then instead of um, keeping that completely empty, he should tick and check on the net observed. And then the marks they have been added there. And after that, then it is decided that what was actually the overall satisfaction level of this clinical supervisor regarding that student, regarding that training. This is another type of assessment, and this is the last assessment we will discuss in the um, practical assessments of the undergraduate student. Basically, this portfolios, these are the collection of the student works that are associated with standards they are required to learn. And this collection of work is often gathered over a long period of time to reflect what they have been taught as well as what they have been learned. So actually, this is we can say that that is just a reflection of what is going on, and each piece in the portfolio that is selected because it is in that authentic representation of what they have learned, and it is meant to demonstrate the current knowledge and skills of these students. In simple, we can say that a portfolio, as by nature, is just like a storybook, which capture the student progression of learning throughout that domain, throughout that module. Now, what are the different components? What are different uh, aspects which the portfolios uh, can have documentation of that? So that portfolio can include overall classwork, artistic pieces, photographs, and a variety of other media, all demonstrating the concept that they have been in master. And each item that is selected to go and the portfolio is chosen within the parameter of the purpose according to the curriculum what they have been taught. So if we are going to summarize these components of the portfolio, so that may be the case report, record of the practical procedures undertaken, there may be the video tapes of consultation, that may be the photograph of the patient, there may be the audio and video description in that essay type, and they have been written the story in an essay form, what they have been discussed, and the procedure which has been discussed between that trainee or that student and the patient. That may be the reports regarding the different projects in which they are on. There may be sample of the performance evaluation, some plan related to the learning, and the written reflection about the evidence provided. So all these that include will be a simple portfolio. The scoring methods of these portfolios that include a checklist and rating scale, like we discussed previously. And these checklist and rating scale, they are developed for a specific learning and assessment context. Scoring are usually carried out by several examiner and what is the purpose of by several examiner just to reduce that biasness, just to reduce that selection bias, we can say the favoritism biasness, or if maybe the observation biasness as well. So that's why usually the scoring they are carried out by several examiners who probe the students regarding the portfolio contents and decide whether the student have reached the required standard or not. These portfolio assessments they are considered a valid way of assessing the outcomes. However, it has low to moderate reliability, and due to the wide variability at the way portfolio structure analysis, its use is very limited. Also, this form of assessment is not considered very practical due to the time and effort involved in its compilation and evaluation. So we can conclude that there are uh, both the pros and cons of the portfolio assessment. If we just talk about what are the different pros of portfolio assessment, so portfolio assessments that demonstrate learning over the course of time rather than what a student know in a particular day. It's ongoing process. It's to cover the overall domain duration. Another pros of the why the portfolio assessment should be used, that is these assessment that provides an opportunity for a student to reflect on their learning, to self-assess and to formulate a deeper understanding of the concept they're learning beyond a simple surface explanation. Similarly, another benefit advantages of this portfolio assessment is that these assessment requires a great level of individual interaction between the student and a teacher, wherein they are in always collaborating about the requirements and components which is going into the portfolio. इन तमाम एडवांटेजेस के साथ साथ कुछ ऐसे जो अभी हमने डिस्कस किया कि कॉन्स भी है पोर्टफोलियो असेसमेंट के, जिसमें से इसकी जो रिलेबिलिटी की बात हमने डिस्कस की, या जो टाइम है, ये जो है इस इज वन ऑफ दोस cons. So this development assessing a portfolio is a time consuming. As we discussed, it take a lot of effort from both the teacher and the student, and is a demanding endeavor in which the students can quickly fall behind. Similarly, the portfolio assessment they are very subjective in nature, and even if the teacher utilizes a rubric, the individualized nature of the portfolio make it difficult to remain objective and stick to the rubric. Two students working on the same learning standard may have two totally different approaches. Thus, learning may not be the same, and that is the reason. Because of this, its reliability is low to moderate. There is a wide range of variability. And for these reasons, the portfolios they are commonly used for the formative assessment. That is that, which means we have discussed in detail, but if I'm going to summarize this, what we mean by the formative assessment, that mean the midterm examination. That mean the assessment inside that course duration at week and monthly basis and weekly basis, or it may be random. One is that is final term examination, that is actually the summative examination. So as it is a daily routine and not a specific day, it is ongoing process, so it is best for the formative assessment. Why it is best for the formative assessment? As we have discussed, that gives a good reflection of what they have been taught, and what is their, it give a feedback to the students. So that's why they can decide either they are going in the right direction, they are doing the best, or still there is some window for improvement. So that's why this portfolios they are commonly used, and they are best for the formative assessment rather than the summative assessment. And that is the reason they are very less commonly used in the summative examinations. The strength and extent of the evidence base for the educational effects of portfolios in the undergraduate setting is limited, as we discussed in the start, that these are usually run comprehensively and most commonly for the trainees when they are working after their graduation. But still, literature, there are studies which have been done and been there supporting the use of these portfolios at the undergraduate level as well. So, concluding all these various assessment methods that test a range of competencies, they are available for the examiners. The choice should be dictated by fitness for the purpose and a number of utility criteria. The importance and weighing of these criteria depends on the purpose of assessment method, either that is summative or formative or both. And after all these, then the examiners they will decide either which type of assessment is used and should be used and which assessment is most fit and the best for those students. So that was all about the different assessment method used for the practical skills assessment of the undergraduate students of the health sciences. In the next session, in the continuity of this one, we will discuss about in detail about the MCQs. हमने स्टार्ट में डिस्कस किया था कि हम दोनों में से जो मोस्ट कॉमनली यूज होती हैं इन पाकिस्तान, हम उस पर ज़्यादा फोकस करेंगे इस लेक्चर में। जो हमने डिस्कस किया, अगर हम मैं थोड़ा सा इसको मैं पीछे चला जाऊँ और इसको एक स्मॉल सा रिकैप दे दूं, तो हमने डिस्कस किया था कि डिफरेंट असेसमेंट मेथड जो हैं ये उसके लिए यूज होती हैं कॉग्निटिव डोमेन के लिए या नॉलेज के लिए, जिसमें मल्टीपल चॉइस क्वेश्चन है, बोथ द ए टाइप एंड द आर टाइप, जिसमें की फीचर्स क्वेश्चन है, शॉर्ट आंसर क्वेश्चन है, ऐसे क्वेश्चन है, मॉडिफाइड ऐसे क्वेश्चन है एंड द स्क्रिप्ट। अच्छा, इसमें इम्पोर्टेंट जो है बात ये है कि इन तमाम में से जो ये सीटी है ये बहुत कम यूज होती हैं, और आजकल जो undergraduate health sciences हैं, which include the nursing, which include the paramedical sciences, which include the DPT and all other health sectors undergraduate level programs. They all are having the multiple choice question. Even the medical students of the first and second year, they are having in the final term exam in the multiple choice question. So that's why among all these, we have discussed briefly in the previous sessions, but in the next session, we will talk about multiple choice question in detail, that what is the different types of multiple choice question, what is the anatomy of the multiple choice question, what are the different pathologies of the multiple choice question and how we can manage these pathologies. We will also discuss along with examples that what are the commonly flaws, what are the commonly mistake the examiners do while constructing the MCQs for the students. And I hope after this session and the multiple choice questions, all the audience there will be experts and even they will know the common mistake and flaws, and the MCQs, the multiple choice questions, that will be of high level, they will be of good quality when they are going to construct them. Most of them, most of you, you will be already familiar about those flaws, and most of you may have familiarity about the standard of MCQs, about how to construct, but we will have a recap of your discussion on the different flaws, mistakes in the multiple choice question. Similarly, if we visit the practical assessment methods, so there are again many different methods which can be used for the assessment of performance, in which they are the objective structure clinical or the practical examination, as is shortly known as the OSPE or the OSPE. So these both are commonly used as compared to the DOPS, which is the direct observation of procedure skills, the peer assessment, the self-assessment, the patient service, and others which we have discussed today. But among these, in medical sciences, in the health sciences, and the both fundamental and most important in the summative examination, the OSPI, they are most commonly used. So among the practical assessment tools, we will discuss in detail about the OSPI, that what is the procedure of OSPI, what are the different components of OSPI, what are the cause and pros of the this OSPI, how many stations there should be. So we will discuss in detail about the multiple choice question about the OSPI in the next session in detail. So that was all about the brief discussion about the different assessment tool for the assessing the cognitive domain as well as the psychomotor domain of the undergraduate of the health sciences. Thank you so much. We are going to meet in the next session.